Welcome back, viewers. Thank you for staying tuned at the GTV. This is the Afya Leo program. And remember, as I said earlier, you can keep your questions coming, your comments, your suggestions via the number on your screen, that is 0711 352 883. 0711 352 883. And today in the Afya Leo program, we are talking about hypertension, and we are tunalalia sana upande wa the pregnant women, and Nurse Rhoda is in today to help us know much and better about that. Welcome back.
Thank you.
So before we went for the break, we were talking about signs and symptoms. Now we have come to the point of the prevention or the management. How is HBP managed?
Okay, generally I will talk about prevention of hypertension. And prevention can varies from factor to factor. For example, I talked about lifestyle. Lifestyle can be how we live, what we eat, how we practice. But for example, in our nutrition, we need to not only eat, but eat well. We need to include fluids in our foods. We need to avoid a lot of fat. We need to increase vitamins. Okay, I know that is another topic of nutrition, but our lifestyle matters. And we need also to update our lifestyles and avoid a lot of fat. Also, let's avoid a lot of salt intake. For those who love nyama choma, please, when you take nyama choma, just take a lot of water or a lot of fluids. I know you are there, you are going for nyama choma today, but after that, always ask for a glass of water. Also, we can prevent by exercises. The more we do our exercise, our bodies do exercises, the more they increase the more they increase the rate of metabolism, and that one also can prevent us from getting hypertension. So it is always good to take maybe a good walk in the morning or in the evening, especially for those whose BMI is so high. Those who are above their weight, if we take your weight, always go for a check of weight, height, and a BMI, so that you will know which level you are. So exercise can also prevent. Also, we need to go for a checkup every often or more often than before. You are there, you have not taken your BP for the last 1 year. I would advise you, it is a way of preventing high BP. And also in pregnancy, I said, let's allow our women who are in conception stages to seek antenatal services as early as possible, so that we can diagnose. If there's hypertension, we can diagnose and manage early. And also let us know that if we continue taking a lot of water, I said our kidneys really need to be empowered. And one thing I said is that hypertension will complicate with the organs. It can cause organ failure, especially the kidney. So let us protect our kidneys, let's protect our bodies, let's protect our organs. So if you are not good at taking water, Carol and advise you also be a friend to water. It can help a lot. Some of these prevention and management measures, they are very local, they are very ordinary. You see, our parents used to do a lot of activities, and that is why there was rare hypertension. But now we have relaxed. We have taken good lifestyles. We have taken starehes. We want things to happen, but we also need to check on our bodies. Yeah. So, thank you.
You've talked about complications. You've hint kidogo tu, umetupea ka hint kidogo ya complications. I would ask if you may kindly broaden and tell us what are the complications that come with HBP.
Okay, when we talk about complications of anything, this is the bad effect that comes out of the condition. Someone had hypertension, they were treated or they were not treated, but at one stage or the other, it affected their bodies in another way. It did not remain as hypertension, but it went to something else. An example is stroke. Stroke is a complication of hypertension. This is when this is a cerebrovascular accident, or something that happens when the pressures are too high. And it is one of the most unfortunate complications. The other one can be kidney failure. The other one can be heart failure. Some of the complications of hypertension are very unfortunate, and some of them are irreversible. So we can find other organs being affected out of hypertension. So that is what we say, they have complicated, or the disease has complicated to something else.
Okay, and
yes,
those complications, do they also apply to the pregnant women?
Oh yes, they do apply to the pregnant woman. Actually, in pregnancy, it has some of the complications are very severe. Like there are maternal complications and there are fetal complications. Maternal affects the mother and fetal affects the child. So we can have, for the mother, it can complicate to another condition that we say eclampsia. Eclampsia now is the severe hypertension in pregnancy, which can cause even death. They can cause death of the mother. In cases where you hear a mother has passed on during labor or immediately after labor, some of them are caused by hypertension, either known or unknown. Then for the child now, or for the baby can suffer intrauterine death, that is dying in the uterus. Prematurity, the baby can be born before time, before it matures. The baby can also be born with other complications like malformations, you know. It can also be born with asphyxia. So in pregnancy, actually, it is more painful and it is more severe, and it can cause death also.
And how is HBP treated?
Okay, hypertension is treated with the mild hypertension can be treated with health education on lifestyle and exercises. But for moderate and severe, we use drugs. We have various classes of drugs that can be used to treat hypertension, both in pregnancy and in non-pregnancy. So we have various drugs that are used to treat that.
Okay, and if I may ask, HBP inapona?
Hypertension can be cured, especially if it is attended early. But in many instances, we've got complications which cannot be reversed. But the best way I can explain this is that it can be controlled. Controlling is when we keep the BP in normal range with measures of like prevention and treatment. So in most cases we control, but we also have instances like in pregnancy, immediately the child is delivered, that BP is normal, the hypertension is normal. So we say it is cured because it was managed up to the last stage. But usually what we do is controlling, but we have many instances where it has been cured. So we can say it can be cured.
Okay.
Yeah.
Thank you so much for helping us understand all that about HBP. And now if you may have a word with our viewers, and also give your number for someone who wants to talk to you personally.
Okay, thank you.
Welcome.
Thank you, viewers. I would like to encourage us that we are not very far from managing high BP. First of all, I advise every person, every viewer, everyone who is listening and watching the GTV, please go for a BP checkup. Also, make it an habit of doing exercises every morning you wake up. You can do some simple affordable exercises. It's not a must you go to the gym. Your house can be your gym. Also, I want to advise many of us who don't love water, please be a friend of water. Always hydrate yourself. Also, it's good your lifestyle. Check what you eat. Let us concentrate mostly on the balanced diet, and we shall live well. Let us live well. Let us eat well. Let us be happy. Let us be a nation without hypertension. Thank you. My number is 0720-818-994. Goodbye.
Okay, thank you so much for coming, and thank you for the discussion. Thank you so much for keeping in touch with the GTV, and thank you for being our friend. Thank you for the love that you've been showing us. Thank you for the support. Niwaambia nyi watu ni wa true. Thank you for watching the GTV. Usiende mbali, because we have a lot of programs that are lined up for you. Hapa tutakuchekesha, tutakuelimisha, tutafanya kila kitu hapa. So kindly subscribe to our YouTube channel. Hapo utaona zile programs zote zenye zimekuwa hapo, in case you missed any of our programs. And as I told you in the beginning of this program, that you can be part of our programs by supporting us via our till number, that is 96268895. And you can also keep your comments, keep your suggestions coming via the number that is 0711-352-883, 0711-352-883. Goodbye. That was our time. My name is Caroline Vive.